Hey everybody, ahead for us this half hour. Can a hospital or nursing home worker who refuses to get vaccinated get unemployment? You've asked, and we're going to get an answer as part of our discussion about that healthcare mandate.
Plus a warning today from Erie County's health commissioner. A dramatic rise in cases and hospitalizations compared to last summer when we didn't even have a vaccine, you'll remember. An expert helps us make sense of what is happening there.
And where can Americans currently travel abroad? There are some places that are completely closed to us. Others have a lot of different rules, so we'll have that update for you as well.
But we are glad that you are with us here on this Friday. I'm Kate Welshofer.
And I'm Michael Wooten. Thankfully, we are not seeing our hospitals getting overwhelmed with COVID patients like we're seeing in Florida, Alabama, Louisiana, and other places. But we are seeing an increase.
And at the same time, we're seeing more and more employers mandate vaccinations. We just got an update on the state's requirement for workers at hospitals and nursing homes.
Yeah, employees at hospitals and congregate care facilities like nursing homes have until September 27th to get at least one dose of a vaccine. An advisory board with the state health department unanimously approved that mandate. That was part of the process yesterday.
In doing so, the panel removed the planned religious exemption, saying there's legal precedent to take that option off the table. We know there are some healthcare workers who say they will not take the vaccine, and some have asked if those people are fired, can they get unemployment? And we're going to talk about the vaccine mandate with Vinny Miranda. He's a partner at Lippis Mathias here in Buffalo.
He also specializes in employment law. It's great to have you on, Vinny. Thanks for your time.
No, thanks for having me.
So the State Department of Health has now approved the vaccine mandate for healthcare workers across New York. So for any workers who refuse to comply and end up getting fired, would they be eligible to apply for and collect unemployment?
So Kate, I'm sure you've never heard a lawyer say before that it's unclear, but it is a little bit unclear at this point. There's a reason for that. The Department of Labor doesn't promulgate official positions on issues relating to conduct and unemployment insurance. That being said, there's a standard, and that's if you're fired for good cause, then you're not going to be eligible for unemployment insurance. And that can mean a million different things. Usually it's associated with gross misconduct, insubordination. And here, I don't want to be the employee testing out the theory that if there's a written vaccine policy in your workplace, you don't have a valid exemption, and you're saying that you're not going to get the vaccine because of personal choice, and you're terminated, I think it's likely that you're going to be denied benefits. There's a case from a few years ago in the unemployment forum where they denied benefits to somebody who refused to get was either a measles or a mumps vaccine, which was required as part of their job duties. So we're going to start to see the early returns on this in a few weeks and months as these cases come out. But I think it's likely that people may get denied unemployment insurance benefits.
Yeah, we'll follow that if and when it ends up in the courts. We also mentioned at the top of the show how the state has now removed the religious exemption for these healthcare workers who are required to get vaccinated. I wonder what options would be left then for someone who works in a hospital, works in a nursing home, doesn't want to get the shot. They obviously don't want to lose their job. And then a second part to that question, the State Bar Association today came out and said that it encourages all workplaces to require vaccinations. I wonder, as an employment attorney, how much of an increase are you seeing in those types of mandates, especially since we got full approval for the Pfizer vaccine?
Great question. So now that the religious exemption has been removed from the regulation, which was, I think, on Wednesday, everyone thought it was going to be in. The states indicated they just wanted to be consistent because the religious exemption was not present in the orders for measles or mumps before. So if you want to try to get out of it based on exemption, you're left with the medical exemption. And it's a simple process, but it's not going to be easy. You have to get a certification from a doctor or a licensed nurse practitioner that indicates that this vaccine is going to be detrimental to your health based on a pre-existing health condition. I'm sorry, there was a second part to that, Michael, and we are seeing a big increase in questions around vaccinations, how to implement it. I think when we spoke a few weeks or months ago, we were coming into the summer and the numbers were down, but as the numbers have increased, businesses don't want to close again. And from my perspective, it seems a little bit more culturally acceptable. Clients are less reticent and hesitant to try to mandate vaccines. The bigger companies are doing it. It's now starting to spill out into some of the smaller businesses.
We may see some people testing the waters here in the future. Vinny Miranda is an employment law specialist and partner at Lippis Mathias. Thanks again for your expert insight tonight.
Thank you both.
Thanks, Vinny. Great to see you. We now welcome to the show Dr. Thomas Russo, Chief of Infectious Diseases at UB's Medical School. Dr. Russo, it's great to have you on as well. We talked about the legal, now the medical.
Yeah, and to pick up on what we just discussed with Vinny, there have been reports nationally about hospitals that are already short-staffed and they're worried about losing employees because of vaccine mandates. But at the same time, being unvaccinated, we know, puts people more at risk. So what are you hearing about healthcare workers here locally in terms of how many may refuse the vaccine and therefore lose their jobs? And are you worried about staffing if that starts to happen in large numbers?
Yeah, I don't think we'll see many unvaccinated healthcare workers refuse vaccination at this stage. Our Houston healthcare system has already gone this route with minimal attrition. And further, the recent full licensure of the Pfizer vaccine will reassure some. In addition, there is time to address other vaccination concerns for this group. In the end, I have little doubt that the majority will appreciate the significant benefits. And obviously, these include a health benefit for themselves and their loved ones, particularly against the concerning Delta variant, a health benefit for their patients who are largely vulnerable and at risk for a bad outcome if infected, and lastly, a benefit for our healthcare system by minimizing staff shortages due to mandatory isolation and quarantines that occur when workers get infected and expose their coworkers.
Yeah, we certainly hope you're right. We'll be following this in the coming weeks. These days, we don't often hear from Erie County Health Commissioner Dr. Gail Burstein like we did early on, but she called an unexpected news conference earlier this afternoon, Dr. Russo, and she pointed out where we are right now versus this same time last summer. And it's a dramatic difference. August 25th of last year, we had 42 new COVID cases in Erie County, 24 people in the hospital. Meanwhile, this August 25th, 2 days ago, we had more than 5 times more new cases and more than 4 times the number of people in the hospital. We're showing our viewers the number. Now 111 people in the hospital. Those got reversed. Listen to what Dr. Burstein said about this just a short time ago.
We've seen a very consistent increase of the number of people hospitalized over the summer with COVID-19, where we should have been seeing a decrease. And so we know that it's only going to get worse because the hospitalization numbers follow the COVID case numbers. And so we have to do everything we can to keep those numbers down.
So again, Dr. Russo, 111 patients in Erie County hospitals right now. Your reaction to the county coming out on a Friday and doing this news conference, clearly there's growing concern. I wonder if you share that worry.
Well, cases and hospitalizations are up in Western New York this summer compared to last summer, despite 58% of Erie County residents being fully vaccinated. And this is due to the highly infectious Delta variant. Also, plenty of unvaccinated hosts that are still susceptible to infection around here in Western New York. And there's been a huge increase in risky social interactions. However, here in Western New York, we would be far worse off if we had a lower vaccination rate. And this is evidenced by what we're seeing in many southern states whose hospitals are presently being overwhelmed. So if you're fully vaccinated, you're significantly less likely to get infected and hospitalized compared to the unvaccinated. And more importantly, even if hospitalized for COVID, the fully vaccinated are less likely to end up in the ICU, and the overwhelming majority of deaths due to COVID occur in the unvaccinated. So our vaccines are getting it done. However, the fully vaccinated groups at risk include the immunocompromised and the most elderly. They have an increased chance of severe disease due in part to a suboptimal response to vaccination. And therefore, these individuals need to continue to be cautious and avoid high-risk situations that could result in infection. And this is why a third dose has been approved for the immunocompromised, and likely a booster dose will be approved for older Americans that were vaccinated first.
And quickly, Dr. Russo, we don't have much more time left, but yesterday we reported how there's an alarming rise in pregnant women getting COVID-19, ending up in intensive care units across the country. And there's a myth out there that they shouldn't get vaccinated. You've told us they should. Can you address that hesitancy, and what should expectant moms know?
Sure. So there's a large body of data that strongly supports that pregnant women with COVID have a worse outcome. And they're more likely than uninfected pregnant women to deliver prematurely, land in the ICU, require mechanical ventilation. and die. And the best means to protect yourself is to get vaccinated. This will not only decrease your personal risk, but it's been shown to be safe for both mom and baby. And in fact, babies could acquire antibodies from their moms during from their vaccinated moms during pregnancy and with nursing, and that would be a way to decrease the likelihood of infection in your baby. So please, pregnant moms, get vaccinated.
Always great advice. Dr. Thomas Russo is Chief of Infectious Diseases at UB's Medical School, also practices at the VA hospital. Dr. Russo, have a great weekend. Thank you.
Thanks.
All right, because of COVID, travel restrictions keep changing all over the globe, and we wanted to show you this update from NBC News. The rules are all over the place, but we can tell you there are now currently 5 countries colored in red on this map that are completely closed to Americans: New Zealand, the Philippines, Sri Lanka, Taiwan, and Uruguay.
More than 50 countries are fully open to Americans, then the rest fall somewhere in between with certain restrictions. For instance, more than 160 countries require a negative test before you arrive. More than 80 countries have quarantine rules, and more than 60 countries currently have curfews in effect. A handful, like Canada, also require vaccination.
Yeah, obviously you would want to do a lot of homework before traveling abroad. There are also rules when you come home. There is a special section on the U.S. State Department's website with specific information for every country in the world.